Hi,
Hello, Melanie.
I'm here with Mrs. Jacinta Satya in Bamenda, Cameroon. Cameroon is a low-income, underdeveloped African country. Mrs. Jacinta Satya, I would like to find out, are you a cancer survivor or a patient?
Actually, I can say both because I was diagnosed with thyroid cancer with metastasis to the sacrum. The thyroid was removed, that is, they did a total thyroidectomy and removed the thyroid. But at the level of the metastasis in the sacrum, nothing yet has been done. Nothing has been done yet. So I guess for the fact that I'm alive and surviving, I could say I'm a survivor, but at the same time I'm still a patient because of all the negative effects, the pain that I have on my legs, which is caused by the mass in the sacrum.
Okay, so for how long have you had this?
As a matter of fact, I may not be able to tell exactly for how long I've had it, but what I know is that I was diagnosed in 2010 when I started feeling sick in 2009.
Okay, so what you started feeling sick in 2009, you were diagnosed in 2010. Why that 1 year of no diagnosis?
That period of no diagnosis was actually due to the fact that I was still in Cameroon. I was in Bamenda. I went to several doctors, and I think they did not just think of doing the right test, and they could not come up with a diagnosis. And in July of 2010, when I went over to the United States of America, I was then, the proper test and everything was done, and I had the diagnosis then.
So now you're back in Cameroon. What are some of the challenges you face with your follow-up on your health and getting your drugs?
Actually, the challenges were quite many because, first of all, I'm in Bamenda, and to the best of my knowledge, I've been asking. There are no oncologists in Bamenda. Right now, I'm trying to connect to an internist. I'm still yet to do that. I'm yet to do that. Getting to a doctor is quite difficult, and to talk about a specialist. And if I have to be connected, I'll have to be traveling to Douala or to Yaoundé, and that still is another challenge, given that I have problems with my legs. So, and of course, getting my drugs is still as difficult. They have to be ordered. I have to see a pharmacist who can place the orders when the drugs have been written by the doctor, prescribed by the doctor.
So are you using the prescription which was given in Cameroon, or you're using the same prescription given by your doctor in the US?
For now, my prescriptions are limited to painkillers, and so I'm still using the prescription from the United States.
Okay. How the drugs, like you said, you cannot get them here. You cannot just walk into any pharmacy and get them. So,
Correct.
Is that an indirect way of saying that the drugs are also very expensive?
Yes, they are very, very expensive, and not even available. They have to be ordered.
Okay. So I want to go back to a point you made earlier. It was the proper treatment or the proper diagnosis was not made. Do you feel like almost half of the cancer patients or many cancer patients in Cameroon go through that? are they diagnosed when they're supposed to be diagnosed, or does it get to a later stage before it is noticed?
It will generally get to a later state or stage before it is noticed, because when you are sick, for example, if you have fever, you go to the hospital, they want to treat you for malaria first, and after a series of treatment for malaria, if the malaria is not going away, maybe they want to, add some typhoid treatment, and then they go through those stages and
go to the normal
because
tropical
of
disease.
our level of poverty, no doctor is willing to write a series of tests which you can do so that he will immediately see where your problem lies. They go through a process of elimination, and in my case particularly, since my legs are paining, and the symptoms are the same like that of those who have a sciatic nerve problem, as it is always called, a sciatic nerve problem. I was being treated for sciatic nerve.
Okay.
And nobody took the pains to go for send me in for scans and things like that. And even x-rays that were done were not done with focus,
All right.
so they could not find the mass in the circle.
Okay. So now you're back and following treatment, and you're still struggling. For how long have you been back?
Fortunately for me, I've just been back. It's about 4 months, 5 months.
You say fortunately, but is that not a long time to not have got in touch with a particular doctor who can follow up on you?
No, it is not so bad, because upon leaving the United States, my doctor told me that I just need to do a few lab tests from time to time, make sure my blood work is done, to know that at least the system is functioning normally, and then just continue to take my pain medication. For now, that is the basic treatment I'm following, so it's not that bad.
Well, thank you. We wish you a quick recovery and quick getting the doctor fast.